Which of the following is the most accurate statement regarding the initial fluid resuscitation in neurogenic shock? A. Aggressive fluid resuscitation should be avoided to prevent fluid overload. B. Crystalloid solutions are preferred over colloid solutions. C. Blood products should be the first-line fluid therapy. D. Hypotonic fluids should be used to prevent cerebral edema. Answer: B. Crystalloid solutions are preferred over colloid solutions. Which of the following is a potential complication of prolonged neurogenic shock? A. Acute pancreatitis. B. Adrenal insufficiency. C. Rhabdomyolysis. D. Pericardial effusion. Answer: C. Rhabdomyolysis. Which of the following diagnostic tests is most useful in identifying the level of spinal cord injury in a patient with suspected neurogenic shock? A. Computed tomography, CT, scan of the spine. B. Magnetic resonance imaging, MRI, of the spinal cord. C. Electroencephalogram, EEG. D. Lumbar puncture. Answer: B. Magnetic resonance imaging, MRI, of the spinal cord. Which of the following medications is commonly used as a vasopressor in the management of neurogenic shock? A. Milrinone. B. Phenylephrine. C. Amiodarone. D. Esmolol. Answer: B. Phenylephrine. Which of the following statements is true regarding the management of neurogenic shock in patients with traumatic brain injury? A. Fluid resuscitation should be avoided to prevent cerebral edema. B. Vasopressors should be used with caution due to the risk of increasing intracranial pressure. C. Inotropic agents are contraindicated due to the risk of increasing cerebral blood flow. D. Hypotonic fluids should be administered to maintain osmotic gradients. Answer: B. Vasopressors should be used with caution due to the risk of increasing intracranial pressure. Which of the following laboratory findings is typically seen in neurogenic shock? A. Elevated serum creatinine. B. Elevated serum potassium. C. Decreased serum bicarbonate. D. Elevated serum calcium. Answer: A. Elevated serum creatinine. Which of the following statements is true regarding the monitoring of patients with neurogenic shock? A. Invasive arterial blood pressure monitoring is not necessary. B. Central venous pressure monitoring is contraindicated. C. Continuous electrocardiographic monitoring is recommended. D. Frequent laboratory testing is not required. Answer: C. Continuous electrocardiographic monitoring is recommended. Which of the following statements is true regarding the management of neurogenic shock in patients with spinal cord injury? A. Early surgical decompression is contraindicated. B. Methylprednisolone should be administered as a neuroprotective agent. C. Hypothermia therapy is recommended to reduce metabolic demands. D. Vasopressors should be avoided due to the risk of spinal cord ischemia. Answer: B. Methylprednisolone should be administered as a neuroprotective agent. Which of the following is the most accurate statement regarding the management of neurogenic shock in patients with Guillain-Barré syndrome? A. Plasmapheresis should be initiated immediately. B. Intravenous immunoglobulin, IVIG, therapy should be avoided. C. Vasopressors should be used with caution due to the risk of autonomic instability. D. Mechanical ventilation is contraindicated. Answer: C. Vasopressors should be used with caution due to the risk of autonomic instability. Which of the following statements is true regarding the prognosis of neurogenic shock? A. Neurogenic shock is always associated with a poor prognosis. B. The prognosis depends on the underlying cause and timely management. C. The prognosis is independent of the severity of the initial hypotension. D. Neurogenic shock has a better prognosis than other types of shock. Answer: B. The prognosis depends on the underlying cause and timely management.